Thanks so much for inviting me to give this talk. I'm going to be talking about machine learning and data science at Cal and how we have formed a new division which we believe will transform research and education to meet societal challenges. This work is done with Kathy Yellick, who is the Associate Dean of our new Division of Computing, Data Science, and Society. So, computing and data science at Cal. What we have in this new division, which is called Computing, Data Science, and Society, is a core of computing and data science in addition to cross-campus partnerships, both for educational and for research purposes. So in the new division, we have a department which many of you know, the EECS department at Berkeley. We also have the statistics department, and we have the School of Information. In addition to that, we have something which we're calling the Data Science Commons, which are partnerships, research partnerships with faculty between the core disciplines and all the other disciplines on campus. Now, we are the unparalleled leader in data science education. In fact, that is how the division started, with the data science major. As of now, less than 2 years after we started the major, we have over 1,000 declared majors. Over 6,000 students take data science classes every year. We have hundreds of students TAing and helping to teach this class. And between data science and the CS major and the EECS major, we are the #1 talent producer for Silicon Valley. We're going to convene this new division in a building yet to be built, which we're calling the Data Hub. It is going to be a huge building on a wonderful site in the northwest corner of campus. We started out with a gift from an amazing anonymous donor, a gift of over $250 million. We're still doing more fundraising. And this site will house and convene these partnerships. So here are some of the research themes that we are going to be looking at. We're going to take the core of computing and data science and statistics and information, and we are going to connect across campus with various initiatives, which you see here. Today, what I'm going to do is I'm going to focus on one, public health. And the reason I'm focusing on this is just, a short time after this division was formed to meet societal challenges, we had one of the greatest societal challenges in a very long time. This is the COVID-19 pandemic. And this really requires rapidly putting together cross-disciplinary research teams to tackle many aspects of the problem. You see some of them here, and you also see some themes like security and privacy and scale. So I will tell you about roughly 8 or 9 different research projects that are all rapid responses to COVID-19. The first is a project by Bin Yu and her collaborators. She has many external collaborators and many students working with her on this. And this is to predict hospital demand. So here we were back in mid-March, and we had no idea where the new hospital demands were going to arise. Okay, we knew that there were outbreaks, and unfortunately, I think these outbreaks are not yet done. And so what Ben wanted to do was predict demand 7 days out so that we could get PPE and ventilators to the hospitals that would need it most. The first thing that Ben's team did was data curation. They put together about 20 different hospitals and county data sets. On these, they tried many different models, came up with a weighted combination of 5 of those models that very accurately predicts hospital demand. They also built visualizations so that this could be used by less technical folks. One of the many things they've done is to figure out where to deliver over 1 million face shields worldwide. Okay, the next project I'm going to talk about is data to help the most vulnerable. Josh Blumenstock, who's in the School of Information at Berkeley, has a long time project to try to understand where we find pockets of poverty in the undeveloped world. It's not at all obvious how you do this. It's not like we have voter registration rolls or, we know where people are filing taxes from like we do in the developed world. So in countries like Togo, for example, how do we know? What data sources do we have? And how can we use them? And so Josh has put together mobile phone data. These are usually not smartphones. They're usually pretty primitive phones. And satellite data. And from those, he has found latent variables which predict poverty with remarkable accuracy. So he takes the whole country and he divides it up into 2 kilometer by 2 kilometer squares. And he can point to the ones where the poverty is worst. Now, when COVID hit, it wasn't just a public health crisis due to the pandemic. It's a public health crisis in many of these countries due to acute hunger and starvation. An estimate that over 250 million people would suffer from acute hunger and over 30 million would die of starvation just due to COVID-19. And so Josh has worked with the government of Togo at the highest levels to figure out where to distribute microloans, to take people from acute hunger and starvation back to the just surviving side. And he's doing similar work with Bangladesh, with Uganda, with Afghanistan. Okay, the next project I want to talk about was done by Uros Seljak at Lawrence Berkeley Lab, and also with collaborators not only at LBL, but also at hospitals in northern Italy, in particular in the Bergamo and Lombardy regions of northern Italy. You'll probably remember that these were some of the worst hit regions in the world at an early point in the outbreak of COVID-19. And so, they reported mortality based on death certificates, but those numbers were just way, way off. They were significant underestimates. So Uros and his colleagues looked at mortality data in different age classes over the last 5 years. They also combined it with data from the Princess cruise ship, and they corrected for the underestimate, finding that more than twice as many people died as were actually recorded as COVID deaths. Moreover, they found that the discrepancy increased with age very, very dramatically. It was quite close for people 40 through 49. It was many factors off, almost an order of magnitude off for people 90 and above. The next project is using NLP. So we believe that the literature, the medical literature, probably contains a lot of information of relevance to treating COVID. However, it obviously won't be labeled as such. No one knew about COVID-19 at that time. So what a group consisting of people at Lawrence Berkeley Lab and UC Berkeley did was that, and this was following similar work they had done in material science, but here for the medical literature and the biological literature of relevance to COVID, they looked at a word embedding, and from that were able to understand which previous papers might actually have relevant information on proteins, genes, symptoms, and possible drugs that already exist. So they have analyzed over 80,000 papers and patents, increasing that by 1,500 a week, and they have over 1,000 unique users per week. Talking about drugs, how about drug design? So Jennifer Chayes, who's in the EECS department at Berkeley, has been working for a number of years now on small molecule drug design. She's using a machine learning set of techniques for how to invert very high dimensional spaces. The problem is that there are just too many possible small molecules. So Jen has developed ways of finding the most relevant ones for certain purposes. Here, what she wants to do is use those techniques to find small molecules that prevent the binding of the SARS-CoV-2 virus to the human cell. So, things like the ACE2 receptor that seems to be highly implicated in getting COVID-19. So she is looking for molecules that would prevent that binding. Okay, we also have some studies coming out of the School of Public Health. This is a really interesting study to help the Berkeley campus and other campuses figure out how to safely reopen. This one is done by Maya Peterson, Art Reingold, and their collaborators from the Department of Epidemiology and Biostatistics in the Berkeley School of Public Health. And so what the problem is here is that you want to take in many different sources of data, app-based data on symptoms, exposure, mobility, beacon-based contacts. Talk a little more about this in the next slide. You want to talk in place-based data, like looking at air filter data, that kind of thing. Taking in aggregate public health data. And then you want a machine learning-based risk prediction model to tell you who is most likely to contract the disease. Most epidemiologists agree that you are not going to control an epidemic only by testing symptomatic people. You must do some testing of asymptomatics. But how do you do that? You test everybody all the time. There are models that say that people should be tested every 2 or 3 days to really control an epidemic. Other models say only once a month, so these models really differ. But how do we use the limited resource of testing and surveillance when we have so many people to test? So Art, Maya, and their collaborators are doing a test on, are doing an experiment with matched cohorts. There's one cohort of students in student housing, about 1,000, a matched cohort not in the dorms. There is a cohort of faculty and graduate students and staff who have gone back into the labs, and a demographically matched cohort who are still sheltering in place. And we want to look at the incidence of disease, and we want to use this machine learning based smarter way to determine which asymptomatics we should test. Okay, coming out of the RISE lab from EECS, David Culler, Joey Gonzalez, and their collaborators are helping us to do digital contact tracing. There are many groups across the country and across the world trying to do this, often with phone-based apps based either on the iPhone or the Android platform. So you can have phones from many different places, and there are a couple of twists that the Berkeley group has. So they are also looking at fixed location Bluetooth devices. You could do this either with a phone, or you could do this with a dongle or a bracelet. There's a lot of advantage to place-based devices. And they also have come up with a commons that contains some, although no private or health data, some data. So what do we need to do all of this better? Okay, what we have is we have data, some of it quite private, like health-based, or if we use the location-based beacons, we want to do computation on that. Well, this is really a federated learning challenge, okay? So as all of you know, federated learning is a method for having a lot of data coming in on edge devices like phones, okay? You want to perform, there's some models sitting up in the cloud. You want to perform some learning locally on the edge devices, sharing just enough information to learn something globally. And of course, you want to preserve privacy in these cases. Okay, there are many algorithms for federated learning. We have faculty at Berkeley who have been working on questions of compressing data streams at the edge for their whole careers. Jelani Nelson, when he was in grad school, had a very important paper on what is called sketching. So you replace models at the edge by small mergeable summaries, and he had a very important paper on this in 2010. This year, Martin Wainwright, who is in the statistics department at Berkeley, came up with a way of merging data from different edge devices. This is very important because if I find the optimum on several edge devices and then I take that and I average it, it might not, in fact, odds are it will not be the minimum of the original problem. And so Martin and collaborators found out ways to use operator splitting for distributed convex minimization when you had additive structure. Finally, I want to mention some work coming out from the Spark community, from Jan Stojka, Joey Gonzalez, Raluca Popa, and their collaborators. And what they did was they looked at oblivious cooperative queries. So coopetition is a case in which you need to merge your data, you need to cooperate, but you also are competing, hence coopetition. And what they're doing is they're using hardware enclaves for secure distributed analytics among competing parties. So for example, if each hospital had its own data in its own hardware enclave, this is certainly happening with many hospitals, how do we do a query against those without revealing information? And how do we also protect from side channel attacks on that information, right, through memory and network access patterns? So their OCQ is implemented on an Apache Spark query planner and execution engine. And you may, if you're a cryptographer, you may have said to me, well, why don't you just use secure multi-party computation? This OCQ is 200 times faster. This is just a small taste of the COVID work, the rapid response work that has occurred in computing and data science across Berkeley in the last couple of months. And so our new unit is here to do computing and data science, to strengthen the core and to solve societal problems. The differentiators of Berkeley are that we, of course, have excellence at the core in ECS and statistics and information. We also have excellence across all other fields. We do this at a scale which is almost unprecedented. And finally, the really special aspect of Berkeley is an incredible sense of social commitment. So please do come and visit us at the Division of Computing, Data Science, and Society at Berkeley. Thanks for letting me tell you about it.